I want to give you a tip that works almost all the time for everybody, and the three reasons behind it. And that is asking questions. So many times we want to be experts in our position. We want to be experts in dental health. We want to be experts in everything about insurance or teeth or whatever, right? So what we do is we try to convince our patients or talk to our patients at a level that so they'll trust us and they believe in us. And sometimes maybe we just want to logically teach them things and all of that. And that's okay. But what's happening is a lot of times we're not having real conversations with our patients. We're talking above the patients. We're not communicating with the patients. So my tip of the day for you is to ask questions. Whoever asks the questions is in control of the conversation. And there's three real reasons that I think that you should be asking questions. First of all, when you ask questions, instead of talking so much, but actually asking the patient questions about why they think that way, what their experience has been with that, what is it they're motivated by, what is it they want to do with their teeth, why do they do this, you're getting their motivation behind things. You're getting the way they think. You're getting the way that they value things. You're getting the way they process things. They're telling you about themselves. The more that we can learn about our patients and their motivation and the things and the way they think and what's important to them, the more then we can hone our communication, our case presentations, our communication with them to fit what's going to be real for them, what they're going to hear. So instead of talking so much in the beginning, we want to listen and really hear what our patients are saying, which means we need to ask them questions. The second reason that I want to ask patients questions is because people in general, not just patients, people in general like to talk about themselves. So when you ask them questions, a lot of times they're expecting to come into us and we're going to preach to them, or it's just going to be a boring dental procedure, or they're going to have to wait, or they're going to hear drills and needles and they're not excited about it. The more you can get the patient talking about themselves, asking them questions, finding out more about them, the better the scenario is going to go, the better the time in the office is going to go. People like to talk about themselves. So especially if you have a patient waiting, if you sat them in the chair and we're not ready to start the procedure, talk to the patient about them, ask them questions about themselves. People like to talk about themselves. The third reason is because whenever we're connecting with patients, we should be looking for commonality. We should be looking for something that we can see eye to eye with them on. We may not have the same viewpoint and knowledge that they have on dentistry. We may not agree with them eye to eye on different things in life, but there's always something we can find in common with the patient. So asking them questions and learning a little bit about them can get you to understand, you know what? We both love baseball, or, oh my gosh, we both have kids. How are your kids? Or you love to travel. I love to travel. And it puts a human element to the experience for the patients. So ask more questions. That's the point of the moral of this story. Stop talking so much. Stop trying to educate so much. Stop trying to convince so much. Stop trying to, impress so much, and actually care about the patient enough to get to know them, to learn about them, to find out their motivations, to find out their why, to find out who they are as a person. And you're going to get a lot further with them, with their experience in the office and their ability to make the right decision to take care of their teeth. So write yourself a sticky note, put it up somewhere, and start asking questions. It makes a huge difference for you and your patients.